right. So we're going to welcome everyone to our 2 p.m. special meeting study session. Members of the public will be allowed to address the board with respect to items listed on the agenda only. The law requires that business not appearing on the agenda may not be discussed at a special meeting. If you wish to speak on any item appearing on the agenda, please fill out a speaker card noting the number of the agenda item about which you wish to speak and present it to the board clerk. Can we get a roll call, please?
Supervisor McKelly? Supervisor Flores?
Present.
Supervisor Ziegemeyer?
Here.
Supervisor Baines?
Present.
Supervisor Conant?
Present.
All right. Well, love to have you up, Sarah.
Special meeting study session regarding the 2022 Sutter County Community Health Assessment.
Good afternoon. Sorry to interrupt you before I should have said this. Now, I don't know about my fellow colleagues here, but when something like this, you have certain, this was out there on the internet and so forth. So I had many calls and asking me, and everyone's saying, wow, we're really flunking here and so forth. And this is pretty scary. So my reaction to my answer to them was, there's a lot of work in progress here in Sutter County where the new wellness program towards employees, Blue Zone, and so forth. So I said there's a lot of stuff that has started in the past. Actually, we haven't gone a year yet. So that doesn't take into consideration those different items, and the fact that we are down almost 30% in our behavioral health department doesn't help at all either. So.
Yes, thank you, Chairman, and we are hopeful for the progress that is to be made today as well. And we have a good presentation, and so thank you so much, Chairman and members of the board. And
Yuba-Sutter.live's local government live streams are presented by Plumas Lake Self-Storage in Plumas Lake, where lifelong local residents are helping other residents keep things safe, providing indoor storage units, outdoor RV and vehicle parking, moving supplies, and Penske truck rentals. Details at plumaslakeselfstorage.com. Skip's Marysville Music Cafe with lessons in person and personalized. Instruments including guitars and amps, horns, strings for instruments, and a myriad of music and sound equipment. Skip's Marysville Music Cafe.
County staff. In addition, a follow-up survey accompanied the publication of our draft community health assessment on our website in 2020. And overall, the community health assessment identifies the main illnesses that affect residents, how residents are experiencing health, and also factors that influence health and well-being. Next slide, please. So when was the community health assessment conducted? So the community health assessment was first started in the latter part of 2018 with interviews and community focus groups, as well as survey development and subsequent distribution of the survey at various sites throughout the county and on our website. In 2019, data on demographics, mortality, health trends, and risk factors were collected and analyzed, along with the first community survey responses. And finally, the draft assessment, like I mentioned, was published on our website for comment in January of 2020. Also, the work on the community health assessment that Public Health was doing, we paused in early 2020 due to the COVID pandemic. Many of the public health staff, as you know, were redirected to the COVID response, and we also had key staff departures from the county. Public Health restarted the community health assessment last fall when we hired our accreditation coordinator. And finally, we finished our community health assessment in spring of this year. The final assessment includes the most recent data that's available, which is primarily from 2020. And also, for comparison, the draft community health assessment primarily included data from 2018 and 2019, depending on the topic. Next slide. And finally, I will turn it over to Dr. Liu, and she will discuss what our community health assessment is telling us.
Good afternoon. Dr. Fong Liu, your health officer for Sutter County and Yuba County. I'm going to discuss what the community health assessment showed. Next slide, please. So when we look at the health of a community, there's a lot of ways and a lot of lenses. And one of the lenses for which we want to look is through an established county health ranking. So the Robert Wood Johnson Foundation partnered with the University of Wisconsin Public Health Institute to gather 30 different metrics, and based on that model has a ranking of all counties really within the United States, but we are only compared with other California counties, so the remaining 57 counties. There are 5 metrics that comes into the overall ranking. One is what's called premature deaths. So these are what we call life years lost before age 75 per 100,000. The second one is the percentage of adults who report poor or fair health. The third is the number of days that adults report having poor physical health. The fourth is the number of adults reporting poor mental health in the past 30 days. And finally, the fifth one is low birth weight, defined as less than 2,500 grams for live births. So all 5 metrics are calculated into a model, and then each California counties is ranked. Unfortunately, in 2016, we were at ranked number 27, with higher being better, and then we have now declined to a rank of 37 as of 2021. All right, next slide, please. Another way to look at it is, what are our top mortality death causes? So our top 5 causes of death within Sutter County are cancer, all types, with lung cancer leading within a specific cancer types, coronary heart disease, such as heart attack, cerebrovascular disease, such as stroke, unintentional injuries. These are mainly motor vehicle accidents, poisonings, and drownings, and then Alzheimer's disease, which is the most common form of dementia. And as you can see from the table here, Sutter County performs worse than the state average for each of these causes of death. Next slide. Another way to think about this is through the lens of life expectancy. According to the California County Health Rankings, again, the same Robert Wood Johnson University of Wisconsin assessment and model, we have an expected life expectancy within Sutter County of about 78.9 years. The average life expectancy for California overall is 81.7, so we're slightly lower. And life expectancy actually varies greatly depending on where you live, even within Sutter County. So babies born in the northeast part of Live Oak, sort of the white areas there, and then the areas bounded by Highway 20 Highway 99, Queens Avenue, and Market Street in Yuba City have the lowest life expectancy within Sutter County. And I believe you all have that handout blown up so you can see for yourself the specific location. And I would point you to sort of the white areas there. And as you can see, Sutter counties have large differences in terms of healthcare, health outcomes, life expectancy, even if it's only separated by a few miles. Next slide, please. So now I will transition to talking about health factors. So previously in the previous 3 slides, we talked about health outcomes. Now we're going to talk about health trends and health risk factors. Next slide. So one of those health risk factors that's really alarming in the past several years is the rate of sexually transmitted diseases, especially that of syphilis. So from 2016 to 2020, we have increased 12-fold in terms of our syphilis case rate from an approximate rate of 2.3 per 100,000 to now, as you can see, 28.7 cases per 100,000. That's compared to a California average of 19.5 per 100,000 and a U.S. average of 12.7 per 100,000. 1 in 5 women were diagnosed with syphilis were pregnant, and that's very, very concerning because we are concerned about what's called congenital syphilis, where the pregnant mom can transmit the syphilis to the child at delivery time. And then more than 2/3 of cases were in the young individuals, young adults, aged 25 to 45. In the past several years, we noticed a decrease in terms of reported hepatitis C, chlamydia, and gonorrhea cases, but I really do suspect that's from under-testing, and that we're going to see a rise in that, especially as we enter out of the pandemic. Next slide, please. So now we're going to talk about nutrition, and it's really, really important to think about access when we talk about nutrition. So in 2019, the USDA Rural Health Information Hub noted that 56.9% of Sutter County residents had low access to healthy foods. That's compared to California average about 27% and the U.S. average of about 42%. Well, how do you define low access? So they actually consider us an urban area, and it's defined access as more than 1 mile to the nearest grocery store or supermarket. Another way to think through in terms of nutrition access was what's called food index score. And it really looks into proximity to fresh fruits and vegetables, income level, and also what we define overall as food insecurity. Like, do you have consistent access to food? And a lower score is worse. So Sutter County in 2020 had a food environmental index score of 7.1, lower than California at 8.8 and lower than the U.S. average at 8.7. And we know that food really matters, and especially high quality fresh fruits and vegetables, because it affects our overweight and obesity rates. And according to the 2020 California County Health Rankings, Sutter County had higher obesity rates at 32% compared to the California average rate of 24% and then the U.S. rate of 26%. Next slide, please. Kind of complementary to nutrition is physical activity. So a survey of Sutter County adults, residents, said that 1 out of 4 said they don't exercise really at all, and that's compared to about 24% of Californians on average and about 20% of U.S. Residents overall. Only 67% of Sutter County residents had adequate access to exercise. How we define access to exercise is, do you live like less than a mile away from a park? If you live in an urban area, do you live within a mile of any sort of rec facility? So it could be a YMCA, it could be a swimming pool, etc. If you live in a rural area, it's defined as within 3 miles of that same rec facility. And that's access is much lower, as you can see, compared to overall California at 93% and the U.S. at 91%. And we know that lack of access to exercise opportunities is much more burdensome disproportionately for low-income communities. Next slide, please. So now we shift gear to talk about mental health. And we know very well that persons living with mental health disorders are at greater risk for other chronic conditions, including cardiovascular, heart disease, substance use disorders, and also just a multitude of other things. According to the 2021 California County Health Rankings, Sutter County residents report overall higher number of poor mental health days. So these are self-report, 4.9 days in the past 30 days versus California average of 3.7 days versus the U.S. average of 3.8 days. Approximately 16% of Sutter County adult residents reported frequent mental distress, chronic, likely even severe mental health issues. That's higher, as you can see, than the California average at 11%, and the U.S. average is similar at 11% for California. In addition, we know this and we feel this very palpably. Our Sutter County mental health provider ratio is higher at 280 patients to one provider compared to the California average of 270 to one provider. All right, next slide, please. And then we're transitioning to talk about adverse childhood experiences. We call it shortened as ACEs. So ACEs is exposure to potentially traumatic childhood events, abuse, neglect, domestic violence, household instability. Also could be a really acrimonious divorce, parental and mental illness, substance misuse during childhood. Exposure to adverse childhood experiences can increase your risk when you grow up to be an adult to develop 9 out of 10 leading causes of death in the U.S. It can affect, we know now, brain development, leading to behavioral health problems, physical health issues. It can increase that child's risk of mental health issues and substance use in adulthood. There is a study, a survey called Let's Get Healthy, and over several years, 2016 and 2019, the survey showcased that about 45% of Sutter County adults reported having experienced in their childhood 1 to 3 adverse childhood experiences, and 15% reported having 4 or more. And that's actually tracking, as you can see, with California average at 46% and 16% respectively. Next slide. So now I'm going to turn it back to Leah to present regarding data for a person experiencing homelessness.
I have to remember to put my glasses back on. Thank you, Dr. Liu. So essentially, this slide provides a snapshot of those that are experiencing homelessness in Sutter County. The 2021 point in time count, also referred to as the PIT count, conducted by the Sutter Yuba Homeless Consortium, identified 371 homeless individuals in Sutter County. We are also aware that this point in time count conducted by the consortium was done in a manner different than previous years, and that there also have been some concerns that have been voiced about this data. Also want to note that the 2023 point in time count that is planned for January 2023 will revert back to the previous methodology that was used, for example, in 2019 and years previous.
Excuse me, I got a question. Maybe you have another slide coming up and it'll answer there. I read a study not too long ago that said 75% of women in California were homeless due to mental behavioral health, which they said males, it was actually 25%. I'm curious, do we have any knowledge on that here in Sutter County? I mean, because when you look at like 59% non-Hispanic, I guess I'm wondering,
So what I'll do is
males, females, because when it's a female, sometimes it works better with female doctors. When the male,
So I do have some information on the slide that I'll cover, and then I'll turn it over to Sarah because she has some additional information on studies and different analyses that have been done on mental health and substance use for the homeless population. So what I'll cover briefly is with this slide, if we're looking just at the 2021 point in time count and the data that was collected through that process by the consortium, I'll just cover really quickly a bit demographics, that 59% were non-Hispanic whites, and also the age ranges were both 25 to 34 and also 55 to 64. Each of those age ranges represented about 19% of the homeless population. So what was also found in the point in time count that the consortium conducted was out of the Sutter County households that were homeless, approximately 15% of those households self-reported that they had daily issues with severe mental illness or substance use. Also, with the homeless population, as you pointed out, that number is likely higher, and there's been state and federal estimates that place that number of homeless that experience severe mental illness or substance use is more around approximately 30 to 50%. So I'll turn it over to Sarah in case she has anything additional to add about the mental health aspects.
Pardon my dropping of papers. So I think what we are hearing is that there are self-reported data that folks who are struggling with homelessness kind of share with us, and certain things like PIT counts. And then, of course, those results are likely underreported because it can be really intimidating to share your health information. And so
15%. So that means 85 were still
not reporting those
scary.
conditions. Right.
Very scary.
So and it may be an underreporting, but I think some of the estimates, again, are between 30 and 50%. And so I think over time, as we build trust and processes that allow people to share their conditions in a way that helps them get access to health care, that we might get some better numbers there.
Thank you, Sarah. And I think just an anecdote from our homeless services is, for example, when somebody comes into Better Way and engages in case management, then, like Sarah said, they build that trust and they often open up to their case manager. And some of those issues may then be discussed and then worked on. But likely, as Sarah said, an issue of self-reporting and much lower than the actuality. So I'll move on to the next slide. So what are the community health priorities? As mentioned before, Public Health held 3 workshops, 2 in Yuba City and 1 in Live Oak, and these were with community stakeholders, county staff, and others to discuss the qualitative and quantitative data that was collected, including the 426 survey results that we received from the community. In analyzing the health trends, health risk factors, community feedback, and also our workshop discussions, the top health issues identified were 3: building resilient communities, addressing homelessness, and reducing sexually transmitted diseases. Next slide, please. So another question that has come up is, are there other health assessments locally? And in conversations with the Blue Zone's Yuba-Sutter Executive Director, who is here, thank you, we clarified the Blue Zone's role in focus. So the Blue Zone organization sees itself as a convener and a facilitator, and they're really focusing on 3 areas: people, places, and policy. In addition, both Sutter County Public Health and the Blue Zones, we share the goal and vision to have a healthier, happier Sutter, but our focus and areas of action differ. So in addition, Adventist Health and Rideout and Sutter North also recently completed a joint community health needs assessment. So the community health needs assessment is required of nonprofit hospitals every 3 years. So this community health needs assessment basically focused on 5 primary service areas, and the zip codes are included on the slide. These zip codes are in both Sutter and Yuba County, and also want to point out that the community health needs assessment does not cover the entire Sutter County community, but only a portion. In addition, you may have heard about efforts in Yuba County to complete a community health assessment, and they have started their community health assessment process, and they expect to finish it around the end of 2022. Next slide, please. So what are our next steps? So the public health branch will start working on the community health improvement plan, which we also call the CHIP. So the health needs that were identified in our community health assessment will then inform the actions that we take for our improvement plan. And also, due to the COVID-19 pandemic and the pause in finalizing our community health assessment, Public Health plans to re-engage with our community partners and stakeholders in September, and also hold work groups in the fall. So the work group meetings will discuss the updated data and information that was included in our 2022 community health assessment, assess what has changed in our community since 2019, and also modify or update as needed the top health priorities for the community. In addition, subsequent meetings will focus on creating action plans with measurable goals that will help us address the key health priorities over the next 3 to 5 years. Next slide. So that is the end of our presentation. Really want to thank you for your time and attention. The community health assessment and also associated dashboards are available currently on our public health website. And I just want to thank all the public health staff that helped create the community health assessment and put in a lot of work on this project. And we also have Harman Chauhan, our epidemiologist for public health, and Marco Caro, who's our Cal EIS fellow, who created all the dashboards that you can view on our website. And they really put a lot of work into the community health assessments. I want to thank them as well. And Lexi Kidd is our accreditation coordinator who project managed this effort. She's currently out this week, but really want to thank public health and everyone who was part of this effort. We're more than happy to answer any questions.
All right. I'm going to open it up for public comment. Do we have anyone out in the public who would like to? We're going to close the public comment and bring it back to the board for further discussion. Any questions?
When we were going through this, I noticed that lead still came up. Is that still from lead paint?
Yes, we still have a childhood lead program, and some of it is from paint that was manufactured pre-1977. So if somebody has an old house that has not been painted since then, it's not very likely, but there are issues with that. And there's also a lot of other sources for lead. It can be from pottery, from candy, from a variety of different sources.
Candy?
Mm-hmm. Certain imported candies will often have elevated lead levels. Yeah, there's a variety of different sources of lead, even from the workplace. And so the Childhood Lead Prevention Program works with environmental health to help address that. Anything you want to add, Dr. Liu, on that program?
Just including makeup too. So sometimes if the
Yeah, because I would think that we haven't had lead paint for what, 40, 50 years?
Yeah. But there's just a lot of hidden sources. Yeah. And most of it is imported, but borders are porous. So a lot of these are imported and then we find those out.
Thank you.
Thank you for the presentation. Really appreciate it. Lots of kind of discouraging news in a way, but I mean, we need to identify what the issues are first before we can tackle them. I guess, are there any comments on strategy going forward on what we're doing to address what you brought up, like especially the things you presented today?
Sure, and like I mentioned, the next step is our community health improvement plan, where we're really looking at those 3 priorities that were identified and what can public health do along in partnership with our stakeholders, our community partners. It's not just public health looking at how will we address, for example, homelessness, but working together with our community partners in terms of setting action plans with measurable goals. What is public health and all of our partners going to do to help address this particular priority, for example? So do you have anything to add?
I think before we want to go somewhere, we need to know where we're at, right?
Right.
So the community health assessment and the community health improvement plan, they're basically 2 faces. That's the same coin. And you got to start with assessment, knowing the baseline, and then discussing as a community, multi-sectorial, lots of community engagement, stakeholder discussion, and saying, okay, we have these 3 priorities: building resilient community, addressing homelessness, reducing sexually transmitted diseases. But what does that mean? What kind of goals, what kind of strategies, how are we going to measure those things, how are we going to measure success, how we're going to implement those things. So that is really the hard process with the CHIP. Yeah, but we're excited.
Great. And what kind of time frame on getting the CHIP completed?
Probably any good things will take several months. So we're going to start gathering invitations for those 3 work groups starting in September, and then we'll dive into that. There's some framework from NACO, from Robert Wood Johnson Foundation to kind of show us how to lead these discussions, right? So for example, building resilient community, what does that mean? What does that mean to us within the Sutter County community? Does that mean addressing nutrition and food insecurity? Does it mean, in addition, addressing ACEs, adverse childhood experience? That's up to the community as a whole to kind of elevate that up. We then operationalize it, develop strategies for those things.
Okay. All right. Thank you. Appreciate it.
Dr. Liu, one, or maybe, I don't know who wants to answer. You know, there was about 6 major categories. Which category do you think are we losing the battle on? And I was surprised that STD seemed to be so high. Is that increasing radically?
Yeah, unfortunately, and it's not just us. We're not isolated. It's something that really started in the early 2010s and has just dramatically increased throughout the country, within the state of California, and it's really, really concerning. As you saw, right, in 2016, our case rate was 2.3 per 100,000. We're almost at around 100,000. So basically back just 2016, we only had a handful of syphilis confirmed cases. Now we're up to 115 in 2020. That's a 12-fold increase. And, 20% of those are pregnant women. So that's why I really, really worry, because we do have congenital syphilis, babies born with syphilis. And syphilis is not benign. Syphilis, if you leave it untreated, you have dementia. You can get heart attacks. You can have nerve damage. That's for adults. For children, babies born with syphilis, congenital syphilis, you have bone deformities, you have anemia, you have liver problems. So I want to go back to a time where we don't even worry about that, where people don't even know what congenital syphilis means.
I'm kind of surprised because, it seems like that would be getting better, not worse, in this day and age with all the different things you can do.
Well, and Supervisor, I would just add that there is hope through kind of collaboration and cross-sector efforts, and part of this planning process that our team described would be bringing in colleagues that are working on things like the blue zones, or our first 5 partners who are doing a tremendous amount of work in ACEs and early childhood behavioral health and maternal mental health. So I think one of the things we're really excited to do is to bring forward that work and connect everybody together, because I think there is hope for improvement, and from a community perspective, we really want to be a part of leading that via this conversation.
And thank you, everyone.
Obesity, and what are we doing in the school districts? I'm assuming gonna be working with the superintendents of the different school districts. In a recession, fast food goes up almost 6%, fast food consumption. So just food for thought here. Our businesses, when I say our restaurants, our sit-down restaurants, their sales have gone down 18 to 25% just in the last few months alone. That's what happens in a recession. Fast food goes up and sit-down goes down. And it's a lot easier to get something healthy. I'm not saying fast food, there's not something there in a fast food. You can go through Panera and get something pretty healthy. But what I'm getting at is, for the most part, you're not getting a fat-free cheeseburger. Or, that's going to be just being there and to educate the young folks and so forth and what they're putting in their body. When I got COVID the first time, I lost almost 20 pounds because I didn't want to eat. I like to eat because it tastes good. My wife always tells me you got to eat for fuel for your body. You're not eating for the taste all the time. You're eating to get the right stuff in your body. It's tough to get that out there. It's tough for all of us for that to sink in, saying that, I should have that oatmeal instead of that leftover tri-tip sandwich that I had from the restaurant the night before for breakfast. We've all been there, Saturday, Sunday, you pop in the leftover instead of the healthy breakfast. But it's a big deal. And, I'm so glad, like I said, that we're working with Supervisor Baines and myself are part of the Blue Zones project, and I'm really hoping that really takes off here. And I love the wellness group that the staff has put together. But even more broader, we have Michelle Blake here from Family Commission, and children, which you guys have we have a lot of great programs there, but trying to get the word out to those that aren't asking for the help. When you look at these numbers and you think almost 65 to 70% aren't asking for it, that's tough. And then you look at the areas, and we're all from here, so we know which areas you're talking about, and we're like, well, it's sad to say, but it kind of makes sense, so. And then it goes back to, are we afraid to go into those areas? I'm being serious. Are we afraid to go into those certain areas to offer help for those areas to try to make a difference? So I think, like you said, Dr. Liu, we know where we're at now, and let's all work really hard for a year from now when we come back to this meeting, because we're going to have the same folks up here, that we try to get those numbers, we try to maybe get in the top 15. It's doable. It's doable. Like I said, it just takes work, but we all got to be willing to put the work in, and willing to put the work in our own communities, our own districts, and talking with the superintendents. We need their helps too, especially with the PKs and the kindergartners because now the school, free lunch for everyone. So what kind of food are they giving out? Is the state, I'm assuming that hopefully the state has someone up there saying that, hey, the food that we're serving every day to these kids is going to be nutritious and not just serving them fat every day. Because for the most part, now with the free meals, almost most school kids are taking advantage of that, which is pretty smart to do. So like I said, we have a lot of work to do, but we really have to take this serious. We have to get more help in our behavioral health. So 280 patients to one provider, that's scary. I'm hoping we have that flipped in half, cut in half a year from now too. But if there's no other questions.
To the chair, if you don't mind, I have a question. Do we know, or how do we work on it as far as education versus socioeconomic status versus, and education doesn't solve anything, right? Like, let's take, I don't know, some average citizen, we'll call him Steve Smith. Steve Smith knows that what is healthy to eat. So he has the education part, but he's still occasionally, he could improve his diet. He's probably a little better than average, but has a long way to go. Those folks, how do you get to those folks when they're making their own choices, right? Versus maybe those who don't know? And I don't know what percentage of, say, folks really don't know and really think that eating whatever it is, and maybe it's stereotypical to say Cheetos and potato chips and all that, but maybe it's their regular meals are just unhealthy.
Yeah, that's a great question. And it comes down to the fact that a lot of these problems are due to multiple factors, and they're interrelated, right? And a lot of these are what we call social determinants of health. And that phrase tells us that it's one's income, it's one residence location, maybe multi-generational poverty is along the line that's really contributes to poor health. Fortunately, for a lot of these topics, we're not starting from scratch because the Robert Wood Johnson Foundation, the CDC, we have resources to go to those sites and kind of look at what has been tried in other jurisdictions. So we're not starting fresh. Of course, we have to tailor whatever we discuss to make it make sense for Sutter County. But that's what we will do, is that we will do our homework in terms of the public health branch to pull down all those examples, discuss it with the community stakeholders that we're going to gather and say, hey, here are some examples. What do you think will actually work for Sutter County in the next few years? How can we measure based on what we decide, right?
Thank you. If there's no other questions, we'll close the study session, and everyone can take a break, and we'll adjourn back at 3 o'clock. Thank you very much for all your time and effort in these studies. I look forward to hearing more from you guys.
Yuba-Sutter.live's local government live streams are presented by Plumas Lake Self-Storage in Plumas Lake, where lifelong local residents are helping other residents keep things safe, providing indoor storage units, outdoor RV and vehicle parking, moving supplies, and Penske truck rentals. Details at plumaslakeselfstorage.com. Skip's Marysville Music Cafe, with lessons, in person and personalized. Instruments including guitars and amps, horns, strings for instruments, and a myriad of music and sound equipment. Skip's Marysville Music Cafe.